set this recording because this might be quite useful for us in the future. So just to give you a bit of background information about the community of practice, it was created initially in Kent and Medway in 2013. We had a face-to-face inclusive event with support from Canterbury Christchurch University, East Kent Hospitals and the England Centre for Practice Development. At the first event, we had Beverly Dawkins. Beverly Dawkins opened the event. She wrote the really influential Death by Indifference documents, and Dr. Kim Manley facilitated the activities with us that helped us develop a shared purpose, so that would help us work together over the intervening years. And that shared purpose at that point was to support people, support carers and care workers and professionals to be person-centred, to provide the best quality care and to improve equality and access. We had several projects and annual conferences aligned with that shared purpose. And with support from Health Education England, the community grew to cover the Kent, Surrey, Sussex region in 2016. Between 2017 and 2020, Health Education England commissioned Build to oversee the community, which resulted in two further conferences, the development of a Facebook group and some more localised meetings to develop local leadership. And a significant amount, I ought to say, a significant amount of information being shared via the community blog. And then that piece of work came to an end, and in June 2020, the community was handed back to into the community, back to the region from Build, to Jonathan Cody Mail, who I think is here, Bob Parsons and myself, and we constructed a strategy to refresh our purpose and to re-engage with the community, and along with one or two other kind of events that we've had, this really is the first proper kind of face-to-face event that we're undertaking today as one of our social learning events as part of our strategy. So let me see whether I can get this to work. So on the right hand side, you'll see here, let me just pause that for a moment. On the right hand side here, you'll see we've got this three-stage strategy that we were working with. We wanted to explore the possibilities. We undertook a values clarification exercise in September last year in a Zoom meeting like this with a number of stakeholders, and we put a survey out as well, and we had a large number of responses. Which has led to where we've got to now. It also influences the film that you will see in the box on the left-hand side. The second stage was this idea about social learning in a post-lockdown world. You know, using Zoom meetings and the like to be able to share projects and topics that are associated with and aligned with the shared purpose. And then, you know, we have this overall aim that, you know, we'll get back to a face-to-face environment at some point in the future, but it won't be today, and we are not sure exactly when that will be at this stage. But it's certainly, so we're certainly starting stage 2 today. So if I can show you this film, this film articulates some of the work that we did in stage 1. And working out what our values were when we reassessed them, we re-looked at them from September to December last year.
Hey, my name's Ronnie, and I have had learning disabilities most of my life, but I'm a part of the Learning Disability Community Practice Refresh Report.
My name is Daniel Marsden. I'm Senior Lecturer in Learning Disability Nursing at Kingston St George's and part of the Surrey Sussex Community of Practice.
I'm Bob Parsons. My background is in working with people with learning disabilities from the point of view of their learning.
Okay, this has been taken from an easy read report, so I'm going to start first, and then the others will follow. Bob Parsons Jonathan Cody Mayhall, Daniel Merston took a leadership of the Kent and Surrey Sussex Learning Disability Community Practice of June 2020.
Yeah, in September, we asked people from Kent, Surrey, Sussex, and about the community of practice.
So people said that the community should work with people with learning disabilities and their allies to live healthy, safe and fulfilled lives.
The community will start to look at the opportunities of work to help people live a healthy and safe, fulfilled lives.
The community will organise regular online meetings to learn and meet community members.
And the community steering group will be looking for more people to get involved.
If you would like to share something about your experiences within the community of learning disabilities, or even if you want to get involved, then please feel free to contact us.